Takotsubo is a form of myocardial ischemia affecting a fairly large area of the myocardium in the absence of coronary artery disease. The name Takotsubo derives from the fact that the morphology of the left ventricle at angiography, when these people are affected by the condition, takes the shape of a sort of flask that the fishermen in Japan used to actually catch octopus. So the heart looks very much like an octopus sort of flask of these fishermen. It is a very important condition. It's very important to recognize it. It actually affects, as I said, the large area of the myocardium. It is triggered mainly by emotion. Most of the cases described in the literature are linked to an event which has been pretty serious. I mean, psychologically, bereavement, an accident, being mugged in the streets, that kind of sort of events which actually make individuals pretty anxious and worried. That is the most common trigger. And the mechanism is very interesting as well, because patients with Takotsubo actually have a major problem with the blood flow going to the heart, because the microvessels are shut down by the excessive release of catecholamines during the emotional stress. And this is one of the most common causes. There are other reasons whereby somebody can have Takotsubo, but the most common is this mechanism. And again, it has good prognosis. It requires treatment as any acute myocardial infarction, except that you don't need to do an angioplasty because there are no obstructions to the arteries, but the patient will require to be monitored in a CCU, and gradually the function will recover. And one of the characteristics of the Takotsubo is that the function of the ventricle, which is pretty awful initially, will gradually recover over a few months. So prognosis is quite good. But I think cardiologists around the world have now have found ways of identifying this condition and make a proper diagnosis.